Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center in New York City. What is a pleural effusion and how can you detect it on imaging? A pleural effusion is accumulation of excessive fluid in the pleural space. The pleural space is a space that surrounds the lung tissue. The most common benign cause could be heart failure or may be pneumonia, but cancer is also a fairly common cause, with lung cancer, breast cancer, and lymphoma causing approximately 75% of all malignant effusions. Because the pleural effusion or fluid has a density similar to water, it can be seen on X-rays. Since the effusion has a greater density than the rest of the lung tissue, it gravitates towards the lower portion of the pleural cavity. So if a patient is standing when obtaining the X-ray, the fluid will go to the bottom of this cavity, the pleural cavity. Chest X-rays can also be obtained in a lateral decubitus position, which means that the patient is lying on the side of the pleural effusion. And therefore, when they're lying, the fluid will shift around and may detect it better and might detect smaller amounts of fluid in this position. Now, CT is the most accurate way of diagnosing fluid, but generally we start off with an X-ray. But if a CT is obtained, it may better characterize the present size and characteristic of the effusion. Rarely, ultrasound can be obtained in a more acute setting at the bedside, but generally we start off with an X-ray and then move on to a CT. Now, it can be treated with aspiration with a needle or placement of a catheter. Sometimes these effusions may also be infused with different medications or substances through the catheter. And I'd like to share with you images of X-rays so you could see what it looks like, and CT scans as well. This is an image of a frontal X-ray on a patient. And what we see is the dark area is the lung. This is the lung tissue. But the white area is the fluid. And as I mentioned, it's denser. So it's sinking to the bottom and the lung is pushed up. This is a patient on their left side. And you could see they're lying on their left side. The arm, it would be up this way. And this fluid now has shifted. This is the same patient with the same amount of fluid. But because the patient is lying on their left side, the fluid is shifting around. And we still see some aerated lung tissue. That's the black part. And this is the right lung, which is the lung on this side. Now, this is another patient who had smaller amounts of fluid. This patient is also standing up. And what we see is the black part on both sides is the lung. In the middle, we have the heart. And then this white part here is the fluid. And there's a smaller amount of fluid in the previous case, but a little bit of fluid. And it even also goes into a little bit of a space in between the lungs. So this is someone who had a heart failure and had these small effusions. Now, here's another patient who is standing up, and what we call here is a frontal X-ray, and this is a lateral X-ray obtained from the side. So still standing up. So while this patient is standing, we see, again, this white part is fluid, which goes down into this pleural cavity because it's heavier. And a little bit of blunting here, which is a small amount of fluid. On this lateral radiograph, you see this is the left side with larger amount of fluid. It's also sinking to the bottom, and this is a small amount of fluid on the right side. So these are pleural effusions, and in the middle, as I mentioned before, is the heart. So the white part is the fluid. Now, lastly, I'll show you what it would look like on a CAT scan. Now, on a CAT scan, the patient is not standing, they're lying on the table. And this image is obtained to orient you. The head of the patient would be up here. This is their spine, and this is the abdomen up here and the pelvis. And what we see is this grayish area surrounds the lung. Now the lung, because the patient is lying on the table, the fluid now can shift, just it shifted when we move the patient on the left side. So it's now surrounding this lung tissue, which is compressed and it's denser, so it's white here. And the fluid goes around the lung. It is in the pleural space. On this other side, there's a smaller amount of fluid, but you could see that the detail would be better on a CT than on a X-ray.